So don't and never give up. This was a quote I encountered while I was searching through this presentation. I will be discussing about suicide in adolescence. So suicide is the deliberate act of killing oneself, and actually suicidal behavior, it comprises about the ideas, the suicidal ideation, the threats or the planning behind the suicide, the attempts, and then it actually culminates in completed suicide. According to UNICEF, recent data shows that almost 46,000 adolescents die from suicide each year, which is a huge number, among the top 5 causes of death from their age group. And if I go by the Indian statistics, India has the world's largest adolescent population, approximately 253 million, and every fifth person in India is between 10 and 19 years. Adolescent suicide constitute a major proportion of the total suicides. This was a recent study which was published in BMC Psychiatry in 2024. It said that suicide is the 4th leading cause of death. And according to the NCRB 2021 report, a total of 10,730 adolescents died due to suicide. And in India reported 12 suicides for every 1 lakh population. Just imagine. And this study actually looked into 35 articles, and then they came up with the statistical data which showed that the major season is March to July. That is what they learned from all the articles when put up together. And the time of suicide was analyzed as day rather than night, maybe when no one is at home, or when the person is alone at home or at the workplace, then or the hostel maybe. The majority of the female suicide attempters were either because maybe the menstruation cycle related issues leading to the hormonal imbalance, and then the emotional upset. Feeling of physical illness such as dysmenorrhea or abdominal discomfort or hormonal disbalance are the major cause of suicidal behavior of female adolescents. Also the peer pressure and the partner intolerance or the partner violence in a slightly elder age group. The older adolescent age group faces greater vulnerability to suicidal ideation and high suicidal risk behavior. It was also seen that the suicide was more common among the rural adolescents, maybe because there are variables such as restricted access to mental health services, there is social isolation, and there might be economic stress which can contribute to this. So why the adolescent is at the crux of suicidal behavior, or why is it mostly seen in the adolescents? Adolescence, it comprises a lot of rapidly occurring changes in the physical, social, emotional, importantly, cognitive and intellectual domains. And it is one of the major outcomes of this rapid development is the risk-taking behaviors in them. It is a transition phase from the childhood to the adulthood. As Vandana rightly said, we have to actually catch hold of that opportunity when they enter adolescence, slightly before that age group. Lack of experience and inability to handle all these changes together bring several mental health issues that increasingly affect these young children or people, I would say. Most important, most commonly reported risk factors, 54% are attributed to mental health problems, traumatic familiar issues, maybe sibling rivalry or the parents fighting. It leads on to the stress among the kids, academic stress, the entrance exams, the pressure by the parents or peer pressure or school pressure, it contributes to the 22%. The social or the lifestyle factors, isne ye pehna, isne wo pehna, lifestyle factors, or maybe stress issues, it also relates to the stress factors, and bullying in the school, it adds on to 20% of the cases. Violence in 22%, economic distresses in 8%, and relationship factors. It was seen in 8.75%. 1 in 7 adolescents experience mental health issues. So why do adolescents attempt suicide? This was a study, and I will be quoting 2 studies which were published in a psychiatry journal. It said that we need to explore the potential impact of diverse gender, sexual, and racial groups. And this would actually improve the detection of suicide risk, and this might reduce the needless loss of life among these young people. This study said that this is another study which said that young people, they need to be categorized into 3 broad factors if we see. There are background factors, there is psychological distress, and there are intervening factors. The most common pattern which is seen is the occurrence of an interpersonal stressor shortly before the attempt. which produced distorted cognitions and overwhelming emotions. If they are able to control that, well and good. But the impulsivity and the ready access to means minded being the final catalyst. If there is no access to means, this might be avoided. If they are emotionally strong, if the build is strong, they are brought up in such a way, it might be avoided. Women appear to be vulnerable partly due to prevailing sociocultural norms in the community. Suicide prevention programs in India need to foster life skills for young people, engage with the high-risk people, and restrict access to the harmful substances. Family stakeholders need to be involved in the implementation. There are multiple options which are available which need to be avoided. And 20% it is being seen that it is because of poisoning. Suicide, the person goes, he has gone because of the last impulsive behavior, but it leads to the eerie kind of silence. It actually affects those who are left behind, the society, the family, the siblings, and all the relatives. I happen to discuss this issue with both the private sector consultants and the public sector consultants in psychiatry who encounter these young adolescents day in and day out. So what they pointed, both of them, I thought that they might point out that rural has a higher issue. Like I spoke to one of the consultants at Safdarjung Hospital, and second I spoke to one of the senior consultants at Sitaram Bharatiya Institute. I thought there might be some difference, but when I came out with their opinion, both of them said the similar thing. The most vulnerable group is 15 to 25 years and more so between 15 to 20. The adolescents who come, mostly they are with self-harm or self-inflicting wounds. They're mostly emotionally labile. They do this because they need to get distracted. They want to overcome their anxiety or depression. There is increased amount of emotional instability. A huge have their peer pressure. They have struggles with their self-esteem, and there is emotional invalidation at home. There should not be any comparisons at home. If there are so, it might somewhere down the line, child may keep on like adding, and finally the bottle opens up. There is an element of sexual abuse. They might not come out with that same, but yes, it is one of the major factors also. So what do we need to work upon? We need to see the identity crisis, the parenting, address the substance abuse, avoid it, family dynamics. We should have a healthy school environment and a supportive family and atmosphere at home. A very important study, it analyzed over the 15-16 years, it saw the trajectory of suicide among the Indian children and adolescents. It was a pooled analysis, national data from 1995 to 2021, which said that the targeted interventions to address the multifaceted factors contributed to this public health crisis. The prevalence of suicide among this population is deeply concerning, and especially considering India's status as the home to largest adolescent population globally. The study also highlights, as I said, that 20% is because of the poisoning. We need to regulate, we need to have strict regulations and enforcement measures to restrict access to lethal means of suicide such as hanging and poisoning. It also emphasizes the importance of addressing the underlying causes, including academic pressure, family problems, relationship factors, mental health issues, poverty, unemployment, more so after COVID, mainly inadequate support systems, which contribute to the growing trends of children and adolescent suicides in India. So how do we prevent? We actually have a school-based prevention, and we also have a community-based prevention. We can go in for screening and psychoeducation. There was a study which divided the school children among the usual care and the counseling sessions. They gave extra counseling sessions to the counseling group vis-a-vis the control group, which had their usual interactive sessions. They saw that the counseling group, there was a reduced incidence of depression and mental anxiety in that group, and the reduced incidence of suicide. I would also like to focus, recently NMC has come up, even in the medical colleges, they have come up with a mentor-mentee concept. Each mentor, the faculty has been given 3 or 4 mentees, and we need to take care of them. We interact with them, and this is actually helping. They create an emotional contact, emotional bond with that person, the mentor, and we take them forward from the first draft till their final sessions. Also, there is community-based prevention, which includes the education, screening, and crisis hotlines should be there. We need to identify youth at risk for suicide, and we need to refer them for help. Can we do something as gynecologists? This was the question which came to my mind. So I also encountered one study which actually analyzed this, suicide among women and the role of women healthcare providers. It saw that intimate partner violence, the substance abuse and mental health issues, if we look into, a woman might discuss with us. And we being the first point of contact, we need to first be aware of the prevalence. If we are not aware of the prevalence, we will never be able to address these issues. We need to understand the risk factors and we need to screen them. We need to refer them. And to summarize, we need to identify the people who are at risk, alert the family members, involve a trusted family member, and have a multidisciplinary approach. Maybe contact the psychologist, clinical psychologist, or a psychiatrist. Urgent need for extensive, targeted suicide prevention measures. It is not a taboo. We can take help whenever needed. Strong adolescent-parent relationships are protective against suicide risk. Enhanced parental support can reduce the likelihood of suicide attempts. Strong familial relationships compared to school and peer relationships actually helps. There is a bill which was passed by the government, the Mental Health Care Bill 2016, which was passed in the Lok Sabha in March 2017. It decriminalized suicide and provided mental health care and services for persons with mental illness. If you just Google suicide, you will get up with these numbers, 24/7 helpline asked by the government. It says you can contact them. There are numbers provided and actually they are working. Suicide Prevention Helpline directly is working in India. So the way forward is preventing adolescent suicide. It needs a multifaceted approach as we discussed, reducing the stigma associated with mental health, implementation of early ideation and intervention, strengthening the adolescent support systems, improving access to mental health services, and it involves a holistic approach. Why not ask them to follow anyone they want? They can follow any god whom they wish to. Even if they don't want, they can go in for meditation. Some people say that I am unable to sleep at night. You can ask them to just play a holy hymn. It might connect them to God. So it involves the emotional, mental, spiritual, physical, and the complete overall well-being of a person in suicide prevention. Efforts should focus on raising awareness, decreasing stigma, timely planning, and developing programs as said. A comprehensive approach is required at government agencies, healthcare providers, educational institutions, policymakers, educators, and the community level to create and implement effective suicide prevention strategies. There is hope, and we need to talk to someone. Hope comes, always talk. Never lose hope. When the sun goes down, the stars come out. Thank you.